Hello, my name is Elvie Rory. This is the Memphis Fire Department EMS training update for the King LTD airway. The King LTD airway is going to be replacing the combi tube, and we should be adding these to our complement within the next couple of weeks. So we wanted to give you something to refresh your memory about the tube. It comes in 3 different sizes. Initially we'll be getting the size 4, and as time goes on we'll be adding the other 2 sizes. The small size, size 3, has a yellow top, and that's for people that are below between 4 and 5 feet tall. This one, the one we're going to be getting first, is the size 4. It's got a red top. It's for people that are 5 to 6 feet tall, and then the one with the purple top is for people that are taller than 6 feet. Okay, the next thing we need to talk about is indications. The indications for this tube are for anybody that we need to maintain the airway. It's for airway maintenance. Anybody you would consider using an oral pharyngeal airway in, you can use a King airway in. We want to encourage the use of it. The contraindications for it are an intact gag reflex, known esophageal disease, and ingestion of a caustic substance. Those are the times that we can't use it. The King LTD airway is a curved tube. It has a connector at the top, color-coded connector at the top. It has a single valve pilot balloon. The balloon, when you inflate the balloon, it inflates both of the cuffs. The distal cuff blocks off the esophagus. The proximal cuff blocks off the back of the oropharynx, or the back of the mouth, and the air comes out between the tubes. So we put this tube into the esophagus and blow the cuffs up, then the air goes straight into the trachea. So in order to insert the tube, the first thing you want to do is pull up the correct amount of air. Now, size 4 tube, you use 80 cc's of air. So you put that on, twist it a little bit, and inflate the cuffs. If the cuffs don't stay up, the airway's no good, and you'll have to get another one. All right, once those are up and they stay up, remove the air from the cuffs. Then we want to put some lubricant on the back of the tube. You don't want to put it on the front part of the tube because you might occlude the airway. So put it on the back of the tube, right at the tip, okay? And you can either place the patient in the sniffing position, which is with the shoulders up like that, or you can do a tongue jaw lift. Okay, which is we'll do on most of our patients, especially trauma patients. You do a tongue jaw lift and just insert the tube. When you put it in all the way to where the flange is at the teeth. The colored flange is at the teeth. Inflate the cuffs, making sure to hold the plunger down while you take it off, or else the air will come back out. Then, what we've done is put this in too far on purpose. So we add our BVM, and when we squeeze it, we're going to feel some resistance. And you notice we're not getting any air movement. So we did that on purpose, remember? So we're going to pull back on the tube just a little bit until it seats in place and we get good air movement. Okay? Now, once that happens, we're pretty sure that it's there. It's where we want it. So, but with any type of airway device, we have to confirm placement. You do that by auscultation. Use your stethoscope, listen over the stomach first while somebody squeezes the bag, and then listen over each of the lung fields in the mid-axillary region, which is over on the sides, and up top. Okay? So you listen over the stomach, and then here, and here, and then in the mid-axillary regions. Make sure it's there. Also, if you notice, we've got the new bags, the ambu bags, or new bag valve masks, that have the end-tidal CO2 detectors on them. The end-tidal CO2 detectors will work with this tube. Once you've done all that and you make sure your tube's in place, then you want to secure it with something. If there's enough of it sticking out, you can use a tube tamer on it. If there's not enough sticking out, that's okay, because people are different sizes. So we just want to secure it with some tape, and tape comes in the package. Now I'm going to take a moment and show you what comes in the package. When you receive this in the field, you'll get a package that looks like this. In the package, you'll have the airway itself, you get the syringe, you get some tape, and the lube. It comes in a little package there, the lube that you need to use with it. Also in the package is a little instruction sheet in case you forget. So it's got little pictures, it goes through all the things we just did. If you forget what size it is, it's written on there, size 4. And then if you want it, just remember to look at also you can look at the color connector, because the red ones are size 4, and those are the ones you're going to use for most of your patients. Just remember the short folks get the one with the yellow, and the ones that are 6 foot or taller, they get the one with the purple top.